In 2007, Mylan Pharmaceuticals bought the EpiPen from a competing business. Since then, the list price of a 2-pack of the drug has increased from $93 to $609 as of 2016. That is a 500% increase in price over 9 years for a healthcare item that saves lives. Other companies have done the same exact thing, bought an important drug and hiked up the price. And in 2015, Martin Skareli drew anger when he bought a drug that treats AIDS and raised the price from $13.50 to over $750. But the EpiPen price has been the most controversial of these changes because it affects so many people, many of whom are children. It has become a controversy that has divided America, with most blaming Mylan Pharmaceuticals. This is a problem with no viable solutions while people are unable to buy this life-saving medication. If you do not understand how EpiPens work, it is very simple. Epi is short for epinephrine, which is a form of adrenaline that can be injected to treat allergy reactions. Without an immediate response to an allergic reaction, long-lasting symptoms or even death can occur. The increasing cost of this medication creates an ethical dilemma. Many believe it is unethical to have the cost of 2 EpiPens to be so high, especially since creating an EpiPen only costs a few dollars. Many insurances are unable to cover the entire cost of this product due to the ever-increasing price, but the need for it is still the same. Especially for lower-income families, it has become increasingly difficult to supply this necessary medication for their families. In 2016, Mylan Pharmaceuticals CEO testified in front of the House Oversight Committee about the drastic price increase. Listen to how the CEO dodges questions that would yield incriminating answers.
When did you guys sit down and decide after 2008 you acquired the EpiPen? When did you decide to use this model of price increase? And how did you come to that decision?
There was a shockingly low number of people who were prepared or protected with EpiPen.
So you decided you should raise the price?
No, sir. We committed to investing in this product, which we have about over $1 billion over this 8 years to provide access.
Okay, and how much have you made over 8 years?
It is absolutely our largest product, but...
No, I just said how much have you made? You said you invested $1 billion. You know how much you invested. How much did you make?
I don't have the cumulative
really?
number.
So
but
you know what you spent. Okay, do you think that you were charging too much? Do you think $600 is too much? Or were you going to keep rising the price?
Sir, which is why we took the unprecedented action of putting the generic in at $300.
No, okay, no, we're not going to, we'll get to that. But generally when a drug goes to generic, doesn't the price go down?
Which is why we dropped it to $300.
Only after you jacked it up to $600. It's like if I go buy this tie and they say it's $600, but we're going to sell it to me for $300, that doesn't make it worth $300. You fixed the price on the drug.
It is very easy to dismiss this shady activity as part of her job to protect their image. However, they have a history of sketchy decisions such as lying to the federal government. Mylan Pharmaceuticals has complete control over the production and distribution of EpiPens. To, quote, help alleviate the cost, Mylan created a generic product which is still around $300. While they marketed it as a competing brand, it is still produced and distributed by Mylan.
The fear is if there's no change, then we're faced with what we're faced with now.
Mylan says they've manufactured a cheaper generic version of the device, but admit they changed nothing but the cost.
Which truly is unprecedented. I mean, we cut the price in half. So
well, it's unprecedented to raise the price $500.
The Snyders hope their work can help others who might go through what their daughter had to suffer.
If you don't think that you can create change, you can.
Iowa Republican Senator Chuck Grassley is part of a team questioning whether Mylan has broken any laws by lying to the government about how they classify the drug as generic. And this is just part of an ongoing investigation that they're looking into. The hope is that these prices will come down if people like the Snyders continue to pressure the manufacturer.
Yeah, a lot of scrutiny right now. Thank you, Don Gurney's reporting live.
In addition, allergy sufferers can buy a syringe for a few dollars instead of using an EpiPen. Many people say this justifies Mylan's prices because they don't need to use EpiPen. But citizens that suffer from allergies, especially children, often only feel safe using EpiPens. It is the treatment they have used for years, and trying to use a syringe while experiencing an allergic reaction can be dangerously difficult. EpiPen is also the only epinephrine brand allowed by law in 11 states to be sold to schools. This monopoly is not only the fault of a gap in competition, but the FDA and state regulations as well. This not only means that EpiPens are the only available products in school, but also for school-sanctioned events such as field trips and sports activities. Solutions are necessary for this problem to be corrected, but it seems that nobody can agree on the correct one. Some people believe that the government intervention is necessary to end this monopoly. Antitrust laws have been used previously to break up these overpowering companies, whereas others believe consumer reform is the solution. They are able to buy a vial of epinephrine for almost 1% of the cost of an EpiPen, in which case they would have to know how to fill the syringe from the vial, whereas EpiPens already have the epinephrine in the syringe. While these are two varying but strong solutions, there has not been a recent change in either aspect.
EpiPens, those life-saving devices that can stop an allergic reaction, are now top of mind for so many parents of Head Start early education-aged children, especially after 3-year-old Elijah Silvera suffered a fatal dairy allergy reaction after someone at his school gave him a grilled cheese sandwich.
The most important way to end this problem is to spread awareness of the situation to promote change for the better, similar to how the Foundation for Economic Education did.
That's what I wish we were talking about. The same exact thing from the same exact manufacturer. I think you can get it over the counter in Europe for $75. One of the reasons, by the way, is that there's 9 different people making the stuff in Europe. One of the reasons they can charge $300 or $600 is because it's too hard to get new products approved in this country. An EpiPen competitor would be even more difficult because it's both a drug and a delivery device. By the way, the stuff doesn't cost anything. It costs between like 10 cents and 95 cents a vial. It's really easy to make the stuff and really easy to get the stuff. But for some reason in this country, there's really only one provider. I wish we were talking about why Mylan can charge $600 for this. Instead, we talked about your profit margins with people who have no clue what that means. We talk about a bunch of stuff that tries to make a lot of us look really good. Somebody in my own party said that there's no way you could really earn $18 million a year. That bothers me. But at the same time, Ms. Bresch, you get what you deserve. Not because you're a bad person, not because you're charging too much or too little for a drug. Nobody in here has any clue. We don't understand the cost. We don't understand the distribution system. We don't understand how healthcare products get priced and sold and distributed. Tell you what we do know, though, is that you've been in these hallways to ask us to make people buy your stuff. You've lobbied us to make the taxpayer buy your stuff. At the federal level, we passed the law here. We did it, by the way. I was here when we did it. Everybody was here when we did it. We did it in 2013. It went by voice vote, one of those magical things that happens when we're not on the floor. The White House called it the EpiPen bill. My guess is that didn't happen by magic. It may have happened because your mother works for the State School Boards Association, or whatever the group is. It may happen because your dad is a U.S. Senator. But you came and you asked the government to get in your business. So here we are today.
Since so many people, especially kids, require EpiPens, they have become the focus of this controversy on the price of life-saving drugs. That being said, an EpiPen is not actually a drug. That's correct. It's simply a medical device, a device everyone should be able to afford.